foot fixer. So a couple of weeks, I feel like it's a couple of weeks ago, recently, we have dry needled of Verruca, and this is this dressing that Stephanie did. So Stephanie, why don't you explain to people what you did?
So I cut up a padding felt just to keep the pressure load of the foot, and then I used Inodine, an antiseptic dressing, to cover the wound, and then just plastered it up.
Fantastic. It looks really nicely secure. So this is just an antiseptic, just kind of to release. Oh my goodness me! Okay. Yeah, it's kind of. In terms of pain from the procedure, obviously she self-administered codeine. We like codeine with paracetamol versus codeine with ibuprofen because ibuprofen kind of suppresses the inflammatory kind of phase of healing, but also we need it to stimulate the immunity. So we don't want to suppress the immunity, we want to kind of stimulate it through the procedure. So I always recommend kind of codeine with paracetamol. I didn't even know that there was a codeine with ibuprofen, apparently. Stephanie, have you heard of that?
I have not.
Yes, I have not. So I always learn something new. And the pain was quite bad for the first 2 days, and then she started taking medication, pain medication, in on day 2 or 3. So that's great. And she also has a medical boot on, kind of like a rocker boot. So that helps offload the pressure so one can function as normal as possible itself. And that's all about kind of healing itself. So let's have a look on this side. And turn your foot back for me, please. Again, just spraying it just to loosen everything up. Because what can happen is, if it's too attached, it can tear the skin, especially with older people that have very, very fragile skin. So what we can see is there's a little bit of weeping still in the dressing, and that's quite fresh. So the wound is still kind of healing. I think we're going to put a semi-compressed felt, I think, on itself, but it's nice and flat. So what I'm going to do is, I just want to see how my patient feels without the padding. I've just changed my gloves to a sterilized glove. I'm not to sterilized, but just changed to new gloves. Sorry, let's repeat this. So what I'm going to do is just going to see how the patient feels without the padding itself. I think I want to put a padding on, but let's see. So I've just changed my gloves and just push against my, yeah. How does that feel?
Yeah, it feels fine.
Yeah. So, not necessarily needs the gloves, the padding itself. Okay, what I'm going to do, just clean it with some saline water, and then do it again and just check. Yeah, is that okay to walk up and down? A little bit of cobbling. You got a medical period? Yeah? Okay, excellent. Also allows your feet to breathe. The padding is quite...
I feel like I haven't really felt my foot in like years.
Yeah, so but in terms of before, if you walked on it, it would be quite painful because of the lesion, right? Yeah. But it's a good sign that now there's not that much pain, right?
No.
Yeah, so remember what we said in terms of treating a verruca, we get rid of the pain first and hopefully the verruca goes. So step 1 tip already done.
Yeah.
Okay, I'm just going to spray some, and tilt your foot back for me, please. Fantastic. Just going to spray some antiseptic. I'm just going to wipe it down. So what you can see is there's a little tiny wound in the middle. That makes sense. And then you've got all those needle marks there where we kind of stabbed it. And that just needs to kind of come off and heal, and we'll see in a couple of weeks what will happen. So what we're going to do now is we're just going to put some Inodine on. Our favorite. And so this is the
do you want to record?
Yeah, you can record it, yeah. We can record while you record. Oh, Stephanie, do the phone in it. Hello. In it. So you got your Inodine, you just put it on the foot itself, just like that, just on the wound itself. Okay. And then like that. Make that one, 1, 2, 3, stay. And then you just put this wonderful piece of plaster that you've got. Just stick it on. And you might, because like I said, your foot movement is excessive, right? You move it up and down. So you might want to just tape it to secure it. Okay, so I'm just going to tape it to secure it. Because you're changing it every single day, once to twice a day, right? You don't need to like overdo it with the plasters. Yeah. So you just tape it to secure. So I'm going to just put another one on. 1, 2, 3, and just really don't try not to like press too hard on the wound. And I'm just going to put another one on. If you're like doing a lot in terms of activity, you might want to put another one on top, okay? But it's not necessary.
Another plaster or another tape?
Tape, yeah.
Tape, yeah.
Because sometimes it can roll off.
Yeah.
And then you just put one kind of like on the bottom and just tape it like that.
Oh, sorry, it is a bit sensitive when you pushed it, yeah.
Yeah, makes sense.
Yeah.
Yeah. Okay, all done. Fantastic.